Hello, I'm Umair Khalid. I'm one of the social media editors at JACC Cardiovascular Interventions, and it is my great pleasure to have Dr. Toshiki Kuno for this interview. Good afternoon, Dr. Kuno. Thank you so much for joining us today.
Thank you. Hi, my name is Toshiki Kuno, corresponding and co-senior author for this article from Massachusetts General Hospital, Boston. Formerly work at Montefiore in New York, where I work for this manuscript. It is a great pleasure to have this opportunity.
Thank you. We are very excited to feature your publication titled Comparison of Patient Outcomes Between Leadless versus Transvenous Pacemakers Following Transcatheter Aortic Valve Replacement in our social media section. And certainly this is a very important topic and can address a lot of clinical questions in current practice. So I would start off with the first question. So how did you design the study and what methods did you employ in your analysis?
Thank you. So we designed our study using Medicare database in 2017 to 2020. Patient age more than 65 and older who underwent TAVR between that period. And also they who received a permanent pacemaker implantation during the same admission subsequent to TAVR. Leadless pacemaker, that is micro VR, gained national coverage by CMS January 2017. So we set the study period starting 2017. We use ICD-10 codes to analyze the data. Up to 2-year outcome, including all deaths, heart failure, hospitalization, endocarditis, and device-related complications. In hospital outcomes include in-hospital deaths or device-related overall complications, including embolism, thrombosis, cardiac tamponade, puncture site complications, device-related complications, and other complications. For statistical analysis-wise, we use propensity score overlap weighting analysis to compare outcomes between leadless and transvenous pacemaker for adjustment. That is the main study design and statistical analysis.
Perfect. Thank you so much for clarifying that. And on that note, could you briefly provide a summary of the key results for the audience?
Yes. So among like 10,000 TAVR patients and with a permanent pacemaker, 7% patients received leadless pacemaker during the study period, where 9,600 patients received a transvenous pacemaker, that is 93%. The proportions of leadless pacemaker increased 3.5 times. Initial study of the first quarter of 2017, 4.3%, but up to 15.2% in 2020 at the last quarter during the study period. In the crude cohort, patients receiving leadless pacemakers exhibit a higher prevalence of comorbidities, including atrial fibrillation and end-stage renal disease. The indication for pacemaker implantation based on ICD-10 code following TAVR was more classified as unknown in the leadless pacemaker cohort and less likely to be a complete heart block. Atrial fibrillation and end-stage renal disease are independent predictors to get leadless pacemakers following TAVR. In the weighted cohort, that is after adjustment, overall complications were significantly lower with leadless pacemakers compared to transvenous pacemakers, 7.2% versus 10.1%. This difference was primarily driven by differences in device-related complications and other complications. In the weighted cohort, there were no significant differences in all-cause deaths up to 2 years, as well as heart failure, hospitalizations, infective endocarditis. The mid-term device-related complication rate was significantly lower in the leadless pacemaker cohort. That is the main result.
Thank you, Dr. Kuno, for describing the results of your paper. And now finally, like with these results and your experience, how do you feel the future is going to be in terms of the two devices, or two types of pacemakers post-TAVR? Do you think people are going to do more and more leadless in the future based on these results? Do you think these are practice changing?
It is hard to say, but Of course, leadless pacemaker has more advantage for less infections, so that is good for like high risk profile, high risk featured patients such as end stage renal disease. And then during the study period, mostly initially micro VR that doesn't have AV synchrony, but right now micro AV is available that has AV synchrony. So I think micro this kind of leadless pacemaker has more advantage for rather than transvenous, but still there is this thing there's some other 10% or something like AV synchrony doesn't happen. So micro AV still has a disadvantage in terms of AV synchrony. So it is hard to say, but for TAVR patient has a lot of comorbidities. So these kind of like leadless pacemaker maybe potential has potential benefit for those patients. Also, we take only 2 years, but transvenous pacemaker has may cause some related transcatheter tricuspid regurgitation. So in terms of that, also leadless has more advantage for that point.
Absolutely. These are great points. Thank you for sharing your insights. And thank you for sharing all these results with us, and congratulations on your work.
Thank you. Thank you for your time. Thank you very much.